Well, good afternoon, everybody. My name is Jonathan Keller, and I am the president of California Family Council. It is a great honor to be with you here today at the Capitol. We are here in conjunction with our good friends at Alternatives Pregnancy Resource Center, or just Alternatives Pregnancy Center. I'm going to introduce in just a minute Heidi Matzke, but I wanted to first off say to everybody who is watching, this is going to be a very important press conference about a bill that is going to be heard in the Assembly Health Committee today. So I encourage you, please, if you're watching this video, please share it on your Facebook page, reshare it on Instagram, on Twitter, everywhere else, but also remember to tune in live for the hearing that will begin at 1:30 p.m. today in the Assembly Health Committee. If you just Google California Assembly Health Committee, you'll be able to find that. You'll be able to watch it live. Please pray with us. If you're somewhere within the Sacramento area and you're watching this, get down here in the next 90 minutes and you can participate in the hearing as a member of the public who can give a public comment. But now I'd like to introduce my friend Heidi Matzke. She is the Executive Director for Alternatives Pregnancy Center, one of the brave and courageous women who lead this movement of life-affirming healthcare options here in the state of California. Heidi is a mom. She is a brave leader in this fight. She's testified not just in front of the state legislature, but she's testified before Congress in Washington, D.C., and I'm going to let her introduce the incredible members of her staff team and the clients who she serves and why we're all here today opposing AB 710. Heidi, thank you for being here.
It is an absolute honor to be here at the Capitol in California, proclaiming a life from this very place. And behind me, you will see very brave individuals. It is our licensed medical team. Behind me, you'll see doctors, nurses, nurse practitioners, physician assistants, medical assistants, phlebotomists, as well as 5 patients who are willing to be here today to testify on behalf of who Alternatives is and to really oppose AB 710. As I begin, my name again is Heidi Matzke, and I'm the Executive Director of Alternatives Pregnancy Center in our beautiful city of Sacramento. I'm here today to oppose Assembly Bill 710, a bill that defames and falsely accuses licensed medical clinics like ours. This bill, as defined in the fact sheet, also seeks to derail women's access to accurate medical information and comprehensive women's health care provided through pregnancy centers like ours. The words "you are pregnant" are some of the most powerful words a woman will hear in her lifetime. In that moment, women deserve access to comprehensive medical care, reproductive options, and medically accurate and unbiased information. At medical clinics like ours, women not only receive this kind of care, but they are also empowered to make the decision that is most appropriate for them and their families, with no judgment. Our services include pregnancy tests, ultrasounds, prenatal care, gynecological care, well woman visits, pap smears, breast exams, STI testing and treatment, abortion pill reversal services, and post-abortive care. All of our medical education information is cited from sources like National Center for Biotechnology Information and UpToDate. These are sources that are widely used by other reputable medical facilities and hospitals. Our website, signage, and phone personnel clearly state that we do not perform, nor do we refer for abortion, all while providing peer-reviewed education on abortion procedures and side effects so that women can make informed choices regarding their pregnancies and their reproductive health. The doctors, nurses, nurse practitioners, medical assistants, and phlebotomists on staff at Alternatives are all licensed medical professionals. Many of them have experienced or even performed abortion in their past, and they are compelled to serve others who are facing the same decision, stating that if they'd only had access to a medical clinic like ours, like Alternatives Pregnancy Center, they would have made a very different choice. Last year alone, our clinic provided nearly $1.5 million of free medical care to the underserved and underprivileged in our community. And yet the powers that participate in are derailing access by preventing advertisement, Google search results, and other social media presence. Today, you will hear from patients who found access to reproductive options, unbiased information, and comprehensive medical care at Alternatives Pregnancy Center. You will hear how 177 women in the last 2 years came to us for services because they were denied care at Planned Parenthood after choosing to opt out of an abortion. You will hear how a transgender individual was denied health care elsewhere, but accepted health care at Alternatives, receiving the non-judgmental treatment she deserves as a human being. You will hear how a woman received little to no information about what abortion was or how it would affect her long term, and was able to find the non-judgmental education and emotional healing that she needed afterwards at Alternatives. You will hear how a woman facing domestic abuse, homelessness, and single parenthood, while finding out she was pregnant, was simply handed the abortion pill as her only option from Planned Parenthood, but was given medical care and prenatal care, abortion pill reversal services, financial support, housing, and emotional support at Alternatives. You will hear how abortion providers have used telehealth to distribute the abortion pill by mail, only to refuse women follow-up care, referring them instead to clinics like ours in order to provide ultrasounds necessary to ensure the health and safety of these discarded patients. Who was there for these women when they needed comprehensive medical care and information? Who was there for these women when they wanted to practice their full right to choose? Not Planned Parenthood, not abortion facilities. Alternatives Pregnancy Center was the licensed medical facility that was there for each and every one of them, regardless of the choices they ultimately made. And we are just one of many pregnancy centers who strive to offer such care. Instead of writing bills that threaten women's access to our services, Pilar Schiavo should be protecting and championing clinics like ours to ensure every woman is able to obtain true reproductive health care. I am honored to be able to stand before you today at this Capitol and defend the truth, and I am humbled and grateful for our God who has made the work of Alternatives Pregnancy Center possible. Everything we do pours out of a heart of love for Him and love for others, because we believe it is by grace we have been saved through faith. It is not of our own doing. It is a gift from God, not a result of works, so that no one can boast. We love others because He first loved us. Now that the facts and the truth have been stated, our leaders must today recognize that this bill would seek to discredit the very facilities that women deserve access to in order to receive medically accurate, comprehensive, and unbiased information regarding their reproductive health, so that they can make the choices that are best and most appropriate for themselves and their families. In short, women deserve an alternative to abortion clinics. That is why today we oppose AB 710. I would like to take a moment now to introduce our first patient, Atoria.
So really quick, before we do that, we have a very special guest. Assemblyman Bill Essayli from the Riverside Corona area is with us. He's on his way rushing to another meeting, but he really quickly wanted to come and join his voice in support of the effort today. Thank you, Assemblyman Essayli.
Thank you so much.
Thank you.
Thank you. And thank you all for being here and being really the voice for the voiceless. The work these pregnancy centers do is incredible, and I've seen it firsthand in my district with Corona Life Services and Riverside Life Services, and the testimony from the women that go to these pregnancy centers it's amazing, and they get nothing but compassion and assistance and help, and they help them physically, emotionally, financially, spiritually. And I don't see anything bad that goes on at these pregnancy centers, and I really challenge whether the author or any co-sponsor has ever visited one. And there should be an open invitation for them to visit one of the pregnancy centers and see firsthand what's happening there, because it is not what they are painting them to be. Really, what this bill is about, this is an attack on choice. They claim they're free choice, but they don't want anyone to have choices. To them, free choice or woman's choice is the choice to have an abortion, and that's it. Not the choice to keep the baby or explain what options they have as alternatives to abortion. And I think maybe next year we need a bill that requires Planned Parenthood to inform patients of their alternatives to an abortion. It totally makes no sense. I stand in firm opposition to this bill, and this bill is not going to provide any public health campaign. It's a propaganda campaign. That's what we're talking about here. We should call it for what it is. So I stand with you. I thank you all for being here and doing the good work you're doing. And I encourage you to keep steady and to don't be discouraged. We will fight this bill. We will fight other attempts. We will fight it here in the legislature. We will fight in court. We will fight, where we need to in our political apparatus to defeat it. So thank you, and we're with you. Appreciate it.
Thank you so much. And now I'd like to invite up our first patient, Atoria. Atoria.
Thank you guys so much for having me here today. This is a very incredible opportunity, and I'm so grateful. So, start here. As I prepared for this day, I asked God to fill me with His Spirit and guide me to a Bible passage that would help illuminate His heart for the unborn through me as a vessel. I'd open my Bible a few times sporadically throughout the day, and each time I'd end up on the same few pages, but I would flip past them as I continued to search. It wasn't until last night that I received the revelation. The word that He was illuminating was found within those same 2 pages that I kept skipping past. Those pages contain the passages of 1 Corinthians chapter 12 through 27, which speaks to the importance of the human body in God's design. Verse 18 says, "But God has carefully designed each member and placed it in the body to function as He desires." Verse 25 goes on to explain, "He has done this intentionally, so that every member would look after the others with mutual concern, and so that there will be no division within the body." These verses not only speak to God's design for the human body, but His design for the members that make up the body of Christ here on earth. Members that are called to look after other members with concern. And this is why we stand in opposition to AB 710, out of love and concern for others. God, the creator and author of all life, the author of the Bible, made certain to include a passage about His careful design and His desire behind every body part, how He intended for there to be no division within the human body. So I ask, who are we as humans under God's watchful eye to intentionally dismember and divide piece by piece the bodies of unborn babies to destroy God's careful design? Who are we as members of the body of Christ here on earth to sit silently and allow for the dismemberment of unborn children, to allow legislation to pass that will create further division and further dismembering, to allow AB 710 to pass without taking a stand against it? AB 710's drowning out of the truth presented by pregnancy care clinics, with its undeniably biased verbiage and the misinformation it intends to spread, will be providing an incredible disservice to women. Women that deserve and require unrestricted access to free alternative options for care. Options outside of for-profit clinics that deceptively seek to profit off of people in their most vulnerable state. Women need safe medical environments where they are treated with genuine respect, love, and care, not treated as a dollar sign and a number on a list. Women need clinics that regard an unborn life as invaluable, rather than placing an actual dollar amount on the ending of that life. Women desperately need pregnancy care clinics like Alternatives Pregnancy Center. The future of women's health and safety depends on it. If we let AB 710 pass, that future is dismally grave. We must fight for life, for women, for children, and for our future. We must fight for what is right, and AB 710 is wrong. I ask that you join me in this fight to stand for life. Thank you.
The next patient that I'd like to invite up is Shannon.
Thank you for having me here today. So my name is Shannon. I'm a wife and a mother of 3 and a former patient of Alternatives Pregnancy Center. January 2019 was one of my life's most exciting and stressful times. I had just left my almost 8-year career only to find out I was pregnant 2 days later. We couldn't be happier, but I had just lost my medical insurance. We weren't sure where to go, and in order to get Medi-Cal, I needed the proof of pregnancy from a medical provider. I figured that Planned Parenthood would help me out since they offer reproductive care, right? Wrong. To my shock, they denied me, and it was more than a denial. When I called for an appointment, I explained my situation and what I needed, a pregnancy test. The woman on the other end said, "Yeah, we don't do that." I was so confused. I asked, how does Planned Parenthood not provide a simple pregnancy test? She said that the only way I could go get a pregnancy test would be to agree to an abortion if it was positive. That was not an option for me. I called another Planned Parenthood location to see if I could get around what I was just told, only to be blocked by their automated system. Press 1 for abortions, press 2 for diabetes, no other options. A few weeks go by, and I'm wondering where to go. In the middle of the night, I started Googling free pregnancy tests near me, and Alternatives Pregnancy Center popped up right down the street from my house. I was nervous. I had never been to a pregnancy center before, so I started reading some of the articles I found online. Every single one had nothing positive to say. They all said that these people weren't medical professionals or licensed, and that they would say anything to make me keep my baby. I was never looking for an abortion, but I wasn't looking to be lied to either. My guard was up, but I needed help, so I arrived the following day at Alternatives. My experience at Alternatives Pregnancy Center was nothing like all those articles wanted me to believe. Medical professionals served me and my husband with smiling faces and kind hearts. Even though I only needed a simple pregnancy test, I got so much more. They prayed with us, gave us gifts, scheduled my next prenatal checkup, and even squeezed me in for an ultrasound with one of their nurse practitioners. That was the first time I had seen our baby on ultrasound, and I was in awe. See, this wasn't our first baby. We had 2 early miscarriages before, so finally seeing our healthy and active 10-week-old was an amazing experience, and Alternatives gave us that gift. Planned Parenthood wasn't there for me when I needed them, but Alternatives Pregnancy Center was. Women deserve access to free, safe, and honest comprehensive medical care that isn't driven to profit from our decisions. Alternatives and pregnancy centers like them are those safe and honest places, not Planned Parenthood. Thank you.
The next woman that I'd like to invite up is Kellee Bradford.
Good afternoon. My name is Kellee Bradford. I'm 43 years old. I'm the mother of 2 daughters, and I've had 5 abortions. Unfortunately, growing up, I was misled and told that Planned Parenthood was the only place to receive care for my pregnancies other than the hospital. When I went to Planned Parenthood, the only option I was given was abortion. Not once did they speak with me about continuing my pregnancy and providing prenatal care and support or other resources. Not one time did they say congratulations. Not once did they sit down with me and educate me on my options other than abortion. Not once did they show me what an abortion actually is and the different types of what abortions look like depending on how far along the pregnancy is. Because if they did, I know I would have made other decisions. When I learned about Alternatives Pregnancy Center and what they're doing, I was baffled because I didn't even know pregnancy centers existed when I needed help. Through Alternatives, I personally met many women who chose to abort like me. We are still battling with that decision many years after the fact. And also many women who had the same question as me, where were the pregnancy centers when I needed them? But because of Alternatives, I am now receiving care and healing through their free abortion recovery class that consists of women in their 20s all the way through their 60s who are so grateful for the services that Alternatives and other pregnancy centers like them provide. The pro-choice movement is about giving women choices, the choice to choose what is right for them. Well, AB 710 is about eliminating those choices. Whether a woman chooses abortion or to become a mother, women deserve that choice. and Alternatives accepts them no matter what at no cost. Women deserve a free alternative to abortion clinics. They deserve a safe medical environment that doesn't financially benefit from their choice. Women deserve Alternatives Pregnancy Center and other clinics like it. Not all women want to abort their babies, and they need free alternatives to Planned Parenthood that provide genuine loving care and support to work through that difficult time, not just one option. Silencing pregnancy centers, vital to so many women and their children, prevents women like me from knowing the best choice for them. Thank God for Alternatives and the blessing they have been to me and many other women.
Thank you, Kellee. And now I'd like to invite up Ariane.
Hello, my name is Ariane Clark, and I'm here today to speak on behalf of Alternatives Pregnancy Center. The first sentence in fact sheet for AB 710 addresses crisis pregnancy centers as fake. In 2019, I was faced with the crisis of a lifetime: an unplanned pregnancy, substance abuse issues, and homelessness. I made an appointment at Planned Parenthood to have an abortion. However, God had different plans. Alternatives Pregnancy Center kept popping up on my Facebook newsfeed. In no way was I derailed in my search. I could have easily gone through with an abortion at Planned Parenthood. I am forever grateful. I was offered an alternative. When I walked into APC, I was broken, hopeless, desperate. They met my desperation with kindness, compassion, mercy, and grace. Never was I shamed or misled. Nothing was fake about the crisis I faced or the help I received. Due to my substance abuse issues, after my daughter was born, she was placed in foster care. APC helped me to find a safe foster home for my daughter and paid for a hotel for me to stay in while I waited to get into residential treatment. They came alongside of women in crisis in a way that abortion clinics would never be able to. I now partner with APC to help moms who are pregnant and have substance abuse issues. Through my crisis and testimony, they see they also have an alternative. A 19-year-old young woman named Elizabeth was referred to me by APC. She was addicted to fentanyl and just as hopeless as I once felt. After spending time with her and showing her that God makes a way in seemingly impossible situations, she chose life for herself and for her son. When I reached out to her and asked her about her experience at APC, she said, "I truly feel like APC saved my life. Who knows where I would be with an addiction and pregnant. I never felt pressured. Alternatives gave me hope, and my son is the greatest joy of my life. I will forever be grateful for them." I pray that you hear the testimonies of the women that are helped by APC and pregnancy centers like theirs. The verbiage used in AB 710 fact sheet are words such as fake, disinformation, shame, misleading, inaccurate, derailed, biased, in a complete contrast to the words that are being used in the real-life testimonies of the women they help, which are hope, grace, compassion, kindness, mercy, and gratitude. I'm going to end with my favorite scripture, Jeremiah 29:11. "For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope and a future." Please do not take away a free alternative to give a woman in crisis the hope and future that they deserve. Thank you.
And finally, our last patient, Jess.
Hi, my name is Jessica, but you can call me Jess. I'm a unique woman. For the past 6 years, I've been taking testosterone, and I've lived my life identifying as a man. I was 21 when I started transitioning. I thought I knew better than anyone, and felt that becoming a man would be the best thing for me because I was a tomboy. I played sports. I felt bigger than other women. I was a woman who was scared of life, scared of an unplanned pregnancy, scared of what it would be to be hurt by a man, to be left alone with kids, to have nothing, to be broken. The truth is, I was scared to be like my mom. In short, I let my insecurities create a new image of me, changing my name and my identity. Aiden was my new name, and although I changed into a nice young man, I still felt unworthy and lost living out this new identity. so I tried taking my own life. This was clearly a sign to me that I didn't know better. At the age of 25, I gave my life to Christ. I stopped believing that I knew better. Instead, I believe that I'm a child of God. I chose to be a man because I felt women needed protection, but I learned that it's not my job to play hero in a situation that I cannot control. With this revelation, I've been off of hormones for 1 year and 4 months, and I was desperate for medical help. As I sat at church on a Sunday morning, I learned about a free medical clinic offering women gynecological care. This was precisely what I needed because I had lost my medical insurance. I've been blessed to have an opportunity to go to this clinic and receive free medical care from medical professionals who do not judge me for my past choices. Instead, Alternative Pregnancy Center empowers women to take control of their lives, bodies, and choices. No doctor has ever taken the time to educate me or medically care for my female body parts. Alternatives did, providing me with the care I needed. This kind of care I would never find at an abortion clinic. I dream of one day getting married, having a family. Alternatives is helping me to prepare for that by simply teaching me about the body I was blessed with. Clinics like these provide opportunities to many women. Some you don't even realize need it. Some are lost, trying to seek free help and understanding. So sorry, folks, I disagree with you. This ministry has a purpose and is helping women that really need it. Thank you.
I just want to thank the California Council for allowing Alternatives Pregnancy Center to represent Bill AB 710. It is an honor again to be before you, and I thank you, all those watching online, for your support, for your prayers as we get ready to walk into this hearing room. Jonathan?
Thank you, Heidi, and thank you to the brave women behind me who spoke and made their voices heard. Thank you also to the medical professionals who are here, and the fact that they are working on a regular basis to provide love and support to women who come into Alternatives. Again, as we said at the beginning, there are over 150 pregnancy centers across the state of California. Some of these are only counseling based, but many of them offer the full range of medical services that Alternatives Pregnancy Center does. I just have to share one little thing for me. My time with Alternatives Pregnancy Center goes back over 20 years because I was a Boy Scout living here in the Sacramento area, and I did my Eagle Scout service project as a 17-year-old for Alternatives Pregnancy Center. I've been amazed to see them continue to grow into the remarkable organization they are today. And again, I know that there are not just dozens, but over 100 of these brave organizations fighting to provide hope and help to people who walk through their doors. I hope that everyone who is watching will call in to their legislators to oppose AB 710. I would encourage you, if you call in, you can find lots more information on our website, californiafamily.org. You can watch the hearing live. Again, it'll be in the Assembly Health Committee today at 1:30 p.m. And I would encourage you, if you call your legislators, there's no need to be angry, there's no need to be rude, be respectful and polite, but let them know that the centers across our state, just like Alternatives Pregnancy Center, are providing indispensable help. They're providing vital resources and support to every person who needs them and who walks through those doors. Thank you again for being here. God bless you, and we appreciate your support.